Thank you, everyone. We are thrilled to get started with Panel 2 on dissemination and implementation of mental health interventions in the LGBTQ plus community. We have an amazing lineup of speakers who are going to be joining us. I'll start at the end and work our way. So John Pachankis is the David R. Kessler Professor of Public Health, Psychiatry, and Psychology at Yale University, and he is the founding director of Yale's LGBTQ Mental Health Initiative, and is probably almost all of you in the room know groundbreaking research on identifying biopsychosocial mechanisms underlying LGBTQ people's disproportionate risk of mental health problems, but also developing treatments to address these mechanisms and studying the implementation of these treatments in community settings across the U.S. and around the world. We are also thrilled to be joined by Deborah Levine, who is Chief Program Officer with Centerlink, the community of LGBT centers. Deborah has truly been championing the health and emotional needs of adolescents for the greater part of her career, and in her previous role as Director of YouthLink, truly been a leader in developing safe online spaces for LGBTQ members of the community. In addition, we have Claudia Fernandes, a youth mental health and substance use prevention expert with experience in public schools, clinical settings, research institutions. I am honestly not sure if there's a hat you haven't worn. The range of places where you've had impact, which is amazing. Currently, Dr. Fernandes is the Vice President of Research and Evaluation at Born This Way Foundation, and an Assistant Clinical Professor in the Child Study Center, as well as an Assistant Professor Adjunct in the Department of Biomedical Informatics and Data Science at the Yale School of Medicine. Also thrilled to be joined by Caitin Ryan. Caitin is a clinical social worker, researcher, and director of the Family Acceptance Project, and has worked on LGBTQ mental health and mental health really since the 1970s and been a leader in the field. So please join me in welcoming. I'm going to start by just asking you to each just take a minute or two and share a little bit about sort of your connection to this topic and what brought you here today.
Well, as you pointed out, I've worked in LGBTQ health and mental health since the 1970s, and my clinical training is with children, youth, young adults, and families. And at the beginning of the AIDS pandemic, I worked in the South with very racially diverse young gay and bisexual men and their families, and I saw an urgent need for not only accurate information about family dynamics, but also a family support model that would help racially, culturally, religiously diverse families learn to support their LGBTQ children. And so for the past 30 years, that's what I've been working on. And we've been able to see incredible growth in families who get access to accurate information in a way that's culturally relevant for them. And we've moved from doing individual work to doing digital work and now beginning to do work with AI. So it's been a progression, as I know for so many of you, and it's so exciting to be at this conference and hear the many ways that you're all doing this work.
Hello, everyone. Dr. Claudia Fernandes. Can you hear me okay, or should I hold it and live out my dream of being a content creator? Do that if that's better. It is such a pleasure. My pronouns are she, her, hers. I'm the VP of Research and Evaluation of Lady Gaga's Born This Way Foundation. No, I will not be doing the abracadabra dance, although catch me after hours, maybe. So my career actually started as an educator. I worked in the public school system for 10 years. I was a public school teacher, a bilingual school counselor in New York City, and then I was a part of the leadership team in opening up a Bard High School early college in Newark, New Jersey. And front and center was always working with young people. I was the GSA advisor, working with young people, ensuring that we were creating systems inside our school that reflected what they wanted and what they deserved in terms of support and resources. I then transitioned to the next decade of my career. Yes, I'm old. But the next decade where I focused on my dissertation, looking about how to shorten that gap between policies and practices, and then did my postdoc in the Yale School of Medicine, where I focused on digital mental health interventions and co-creating them with young people through and through every single step of the way. Today at Born This Way Foundation, my work and our work as a team really focuses on being informed by science and being informed by young people. And so we'll be talking a little bit about how, especially with some of the partnerships here, how we do that, which I'm really excited. So thank you. Thank you to UVA. Thank you to Santa Clara University for hosting this. I think more than ever, I have certainly felt the need to be in community with all of you, and it's a pleasure to be here.
Hi, is it working for me? No. Okay. Try it higher. How's that? Good. Thumbs from the back. So my name is Deborah Levine, and I use she, her pronouns. I currently work with Centrelink, which is the community of LGBT centers. Our mission is to strengthen, support, and connect over 350 LGBT centers across the United States, Canada, and a few beyond. And I will just put in one little plug from the last panel. Someone asked about local services. At our website, lgbtcenters.org, you can find your closest LGBT center. And even though about 50% of them have 5 or fewer staff, they do everything in their power to know the local resources, to know the affirming therapists in their area. So wherever you come from or wherever someone reaches out to you, I do encourage you to use that directory. Unfortunately, it doesn't list addresses any longer, but it does list the city at least for safety purposes. So you should be able to find. So our mission is to support and strengthen and connect those community centers. One of the ways we do that is to get the word out about the fact that they exist, so this directory is available to all of you. But in terms of how I come to this work, so previously I was the director of online health education at Planned Parenthood, and therefore digital, we used to call it online. And we did a project that ultimately resulted in the development of a program called Q Chat Space. It provided live, chat-based, supportive conversations for LGBTQ youth. They were synchronous. They happened at a time and ended at another time. They were led by folks who work at LGBT centers. And I did that in partnership. I was at Planned Parenthood, but I worked with Centrelink and PFLAG to launch Q Chat Space. And then my other major, among others, but digital activity in terms of supporting LGBTQ youth was I partnered with Hope Lab and It Gets Better, and lots of other folks in both cases to put out IME.guide, which you'll hear more about in the next panel because there's 2 people who are going to talk about that, so I'll try not to talk too much about it. But ultimately, that's a self-help. It's not synchronous. It's anytime, and you can go right now and look at it. It doesn't take the humans in the background. There's just the humans to develop it. So those are the 2 tools that I'll talk about most today.
Hi, everyone. My name is John Pachankis. It's an honor to be here. I'm a clinical psychologist, and much of my career was just being in the right place at the right time. And in addition to kind of documenting the unique experiences of LGBT lives empirically through research, one of the research projects that I became engaged in early on in my career was kind of low-hanging fruit. And it was simply to take the lessons that we had learned about LGBT lives and meld them with cognitive behavioral therapy and to create a treatment that would at least direct clinicians to how to assess the distinct experiences that LGBT people go through and how to apply cognitive behavioral therapy to treat them. I did this right after graduate school. I never would have guessed what a need that treatment would have filled and how quickly it would have been uptaken, including even today in the Veterans Health Administration that's implementing college counseling centers across the country, various global settings. But also one of the kind of coolest parts, both scientifically, but also feeling as if my career was devoted to helping LGBT people, was when Deborah reached out to me many years ago now and said, "We know about this treatment you've delivered." She was saying she coordinates this network of the U.S.'s 350 LGBT community centers, and she was interested in partnering to build the capacity of these frontline providers at these centers who are providing, something like 2 million people contact an LGBT center each year. And then these centers are often providing free or low-cost care, often because the centers are delivering that care through interns and beginning therapists, the type of therapists who might want kind of the toolkit or training training wheels that exist in the treatment materials that I created. So it's been an amazing opportunity to train. We've trained about 1,000 providers in the past year who have then gone on to deliver the treatment to over 10,000 LGBT youth and adults in their local communities. And thinking of how to increase the access of that type of care, whether it's LGBT affirmative, CBT, or anything, is mediated through the inevitable need for digital tools and telehealth to reach people who otherwise wouldn't be able to reach one of their local centers is kind of the upcoming challenge that we're working with.
Thank you. I'd like to start by talking a little bit about success stories. So we'll talk about the challenges as well, but I'd like to start with some of the amazing accomplishments where we've seen very effective implementation of mental health services for LGBTQ youth. And I'd love to hear what you think have been the key ingredients when it has gone well and we've seen those successes. And I'll start with you, Caitin.
Thank you. Well, what I've learned from my work in the 1960s as an organizer in war on poverty, I first learned how not to enter cultural worlds. And that was a great experience because learning what not to do teaches you what to do. So in my work with LGBTQ health and mental health, one of the key ingredients is participatory. So from the very beginning, we had racially, religiously, culturally diverse LGBTQ people, youth, adults, and elders. Elders are the knowledge keepers in their cultural worlds, and they often get left out, but they're critical in family systems. We also have focused on understanding cultural and religious beliefs and values up front. We actually have a whole culture-based assessment in the work that we do because we use a behavioral frame where we can align with those values, and it's really pretty easy to do that because families want their LGBTQ children, whether they're straight or queer or non-binary or whatever they are, to be happy and healthy. They want to keep their families together. I've found very few families that really have wanted to hurt their children. It's almost virtually impossible for families to do that intentionally. We also have implemented across systems of care, and this is so important because so many young people receive services from multiple sorts of systems, not just one. And by working in diverse systems from the very beginning and implementing our model in those different systems, from behavioral health to child welfare, homeless services, pastoral care, primary care, we're strengthening the referral networks in communities and elsewhere. We also have moved from on-site to virtual, and in fact, tonight is the final session of one of our family support programs, so I'm going to have to leave a little early to go and close it out. But we found a remarkable engagement. We found a major drop in dropping the rejecting behaviors, increasing communication, increasing connectedness, decreasing depression, substance use, and also, really importantly, increasing cultural critical consciousness. And what does that mean? It means a sense of empowerment from both caregivers and young people to be able to do something about the environment that we're living in right now. And then finally, we have one of our programs is running now, and all of you are welcome. We welcome families and young people from all over the U.S. in our online programs, and they are from ages 14 to 25. We've got some flyers at the back of the room. That's a program where, because it is a clinical trial and it's funded by the WT Grant Foundation, we're able to pay youth and families to caregivers to participate. And they love it so much that they don't want it to end. So it was successful because we engaged everyone from the very beginning. We didn't leave anyone out. You have to open the door, and it's really like if you build it, they will come, and that's what we found.
Yeah, and +1 on that one. As a behavioral scientist, I'm trained to always think about how to shift behaviors and how to really think of the key ingredients in creating an intervention, a policy, a program, a resource, anything that is, the goal is to shift a behavior. And what we know is that what we've learned is you can have the best intervention out there that is focused on theory, but in regards to implementation, if the user, the intended audience that you are creating this intervention for, is not a part of the process from the beginning, then it'll fall flat. So when I think of implementation, I actually think of engagement. How do we engage young people in this, young LGBTQ plus young people, to engage in the services, in the programs, in the resources? And what we know is by engaging them through and through from the start. And we've done that with our partnership with Hope Lab, where in this case, I actually see our survey as the intervention, because we're trying to learn about how to, or about their online experiences of LGBTQ plus youth. And so we co-created the survey with LGBTQ plus young people. We made sure that the language that we were using was their language, that it was comprehensive, right? We were using their words, right? I'm a geeky scientist. My words don't land. Trust me. I live with a 13-year-old. So these are things that we really wanted to ensure that they helped co-create the survey. After co-creating the survey, over 1,200 LGBTQ plus young people completed the survey and provided feedback. And then, again, in partnership with Hope Lab, they looked at the data and they co-interpreted it to make sure that the findings reflected their lived experiences. And this then created, our key findings in our large report that was launched in March. And from there, we even took it a step further. What we learned was that young people often feel unsafe in their in-person environments. And as such, they then were seeking comfort, affirmation, and safety in their online communities. So we said, okay, we have to take these findings and we have to make sure they turn into active, actionable strategies that can be used and applied in the real world. And so we partnered with Centerlink, and we worked with Dr. Alvin Tran, who's at the University of New Haven. We worked with Amy Green's team at Hope Lab. We worked at the University of Nebraska, Lincoln. And we drafted 3 resource guides. The resource guides are for families, social media and tech companies, and active allies. Why did we do that? We did that because LGBTQ plus youth told us when we conducted our survey that those were the communities that would most benefit from learning and taking action from what they learned from our survey. So that's a way to really think about effective interventions and effective implementation, is to have the science drive it, and then to go back and really think about how this makes sense in your communities.
Deborah, I'm going to ask you to sort of carry forward this conversation to think, both on the success side, but also, obviously, lots of implementations don't go as successfully. And can you talk about common failure points? And I think, reflect on that. I think there's an interesting piece here in this, building on Claudia, some of the things you were saying of, we need to think about centering youth in different communities' voices, not only for initial engagement, but also thinking about sustained involvement in programs. And I think especially when we move into the digital mental health space, that's often where we don't do as well. Like, we're good at sort of sometimes at getting people initially responsive, and then we lose people. So can you talk a little bit about, again, that success and failure point side and across the continuum of sort of program engagement?
Sure. So definitely not engaging youth ensures that you will not succeed. That's what I'll say on that side. One of the major failures that I've seen in projects is there's an enormous amount of resource poured into development, and there's not resources poured into promotion and marketing. And still engaging youth in that process of determining how are we going to get the word out about this. And I'm hoping that this is shifting, but there's certainly the narrative when I started this work in the aughts that was, if you build it, they'll come kind of thing, and it'll go viral. And there's too much out there. It's not going to just go viral. You have to be really intentional about the ways that you go about doing it. And so the two major, actually 3, I'll go further back. So not specifically for LGBTQ youth, but I was also the person who was largely responsible for launching Planned Parenthood's chat and text hotline. And we didn't have to worry about promotion and marketing in the chat and text hotline because the Planned Parenthood website on which it sat already had millions of visitors. So that's one example. That all of the effort that we put into just promoting the website led to young people finding the resource. With Q Chat Space, we didn't have much resources for development, but we certainly didn't for promotion. It was mostly legwork. It was me and a few other people and lots of volunteers reaching out to other organizations. Would you put a link on your website? Would you put a link on your website? Trying to get that sort of organic way of letting the search engines know, like lots of people want to be connecting with us. But it took an enormous amount of resources to get where we were. And to be perfectly honest, if the pandemic hadn't happened, I don't know that Q Chat Space would have persisted. But at that point, people were seeking out and came to us. So there was some luck, right place, right time. But the third tool that I worked on with Hope Lab, they put an enormous amount of resources in both the development side and promotion and marketing. And they thought about it from the very beginning. And what we saw really was in that first 6 months, I think we had, I don't have my glasses on to know my numbers, I think it was 40,000 users in 6 months of this self-serve mental health tool. And then now to date, it's been over 230,000. We launched in June of 2022. And there really were the resources. And the resources were both the finances, but also finding the right partners. In addition to Centerlink, It Gets Better was an early partner and many other organizations. So, I've never really worked for industry, but my imagine that nobody builds something and then says, oh, people are just going to buy it. We really need to, when we're developing these tools, look at the side of promotion and marketing. Because I have, in the many years I've been doing this, seen many researchers produce tools. Sometimes you can't use it because it's being researched and they don't want to taint the data, and I get that. But after the 3 or 4 years, like, let us use it. But then there's not necessarily the funding to do that. So ultimately, the resources, we develop them fabulously and we promote and market them. And funders need to support that, and tech field, industry knows that there's two sides of it at least.
No, I really appreciate that. Each of you have mentioned sort of the importance of partnerships along the way in being able to move the work forward. And I think that's often a place where academics, for example, struggle in forming those partnerships effectively. Can you talk a little bit, and John, I'll start with you, can you talk a little bit about advice you might give for people to be effective in developing meaningful, reciprocal, mutually beneficial partnerships that can be sustained and truly valued, and what that should look like?
Yeah. I mean, I should probably let Deborah speak on the other side of that to verify what I'm going to say. But like I said, it was an opportunity that came to my team's way when Deborah reached out, and that is an important starting point, and that the community came to us in terms of you have a product that was created by and for LGBT young people. Can we work together to implement it? The second thing that I think really worked was that my team at Yale had the time to do it. We weren't applying for an NIH grant. We didn't have the pressure from on high. And a tech developer wasn't coming to us saying, I have a product, can we have this, the brand of your team to put on it? It was something that came jointly from the community that we worked on to implement together. We also, I was skeptical, or I guess I was cautious about proceeding with training all these mental health providers, these 350 centers. So we surveyed the CEOs and directors of the centers, and when 100% of them told us that they would provide staff time for their staff to take time off and be trained in the treatment, was when I was sold in terms of, okay, this is something that it's not just Deborah saying that she suspects that this is what they want. They actually want it. And then we continue to evaluate the impact of the training on the people who receive it. And as long as we get positive feedback or feedback that we can incorporate, we'll continue to sustain it throughout the years.
Deborah, could I flip this in? So John said it was amazing to have you go to John Center. Why did you, this is a bit of a silly question, but why did you go seek out John in that way? What were the positioning that you had done in order to be such an obvious partner in this work?
So ultimately, I read a published paper, and I was like, if this works, and I knew there was more than one paper, if this works, then people that I'm working with should get access to this. So I sent an email to someone else who said John was actually the person and forwarded. Like just seizing those opportunities and seeing what's known. But I think in terms of this question, one of the key things is the, and you phrased it, you said like mutual and pieces, really focusing on that, because in the time I've done this work, so when I started Q Chat Space, we were seeking funding, because of course you need money. And a lot of tech funders had innovation streams of funding. And you get funding, but then you also had to attend these trainings, cohorts, and it was about user-centered design, generally. And ultimately, like, we did user-centered design, we just didn't know that's what it was called. And the researchers that we worked with, they were doing user-centered design, and they called it community action boards, right? So we each had different language. But the mutuality comes when the partner really knows that and doesn't make this assumption. So I did apply for a lot of those funding opportunities. Thank God I didn't get any of them, because they would have been a time suck of learning something that, yes, I would have learned something, but it didn't recognize the expertise that we were each coming to the table with. And I think when we developed Tiny Guide, that was really obvious that Hope Lab, which is a nonprofit tech firm, that's the way I think about them, but I'll let they really saw our expertise. Even though we were a super small nonprofit that wasn't well funded, we had built this network of 350 centers. That's our secret sauce. We can get something out to 300, I mean, not that we're not going to jump on it, we know that, but that's what we brought. And Hope Lab respected that. And It Gets Better brought this immense expertise around getting the word out in the digital space. So valuing each other, really having that mutual, and I think it's when someone comes to the table thinking that they have expertise that's better than or supersedes the other organizational partner, that things don't tend to work out as well. So that would be the secret, and I think that's part of what works with us. Like, I'm always, you do your magic, John. All I got to do is send out an email to everybody and then call them again, because I know they're busy. But ultimately, it's about knowing each other's expertise and special strengths.
And that's your magic. I'd love to answer this question too, because I'll say at Born This Way Foundation, our most important partnership is working with young people. And so we are a youth-serving, youth-centered organization. And it's interesting because what ends up happening is progress moves at the speed of trust. And so you start to see other organizations that operate in this same way, where it's the young people, when they're conducting research, they're really being thoughtful about their participants. If it's a community-based organization, they're being thoughtful about who they're serving. And they are involved in the process. And so similarly, when we partnered with Hope Lab, there was this just synergy between us of, oh, this is how you do things? Cool, because this is how we do things. Sometimes it was different, but we learned from one another about how to engage young people and how to use, as I shared, we have a youth advisory board. It is approximately 35 young people at Born This Way Foundation. And they represent over 6 continents. They represent 6 continents. And they're between the ages of 15 and 24. So we were able to use them when we were conducting our research with Hope Lab to review the survey, provide feedback on the content, and make sure that it was being comprehended. The language was understandable. So I think, and taking it another step further, it's important that we include the young people in a way that's not tokenized. And so there shouldn't just be one person at the table. We should actually have tables full of young people in the work we do if we are a youth-serving organization or a youth-centered organization. And so, and it has to be, to Deborah's point, it has to be symbiotic as well. And so we try that also. We try things out at Born This Way Foundation. For example, we asked we had young people attend research learning labs to learn more about our research, learn more and connect them and give exposure to science. We learned from them that approximately 70% of attendees had little to no experience with research. However, 90% of them intended to apply research to a future role. So for us, we're listening to the young people on our advisory board, and we're trying to then provide opportunities for them to network with researchers and scientists, to learn a little more, scratch the surface and have some exposure to, the different projects that we have, how we're evaluating things, how we're conducting a systematic review. Because we want to also provide skills that they will need and that they want in our environment as well. It's a symbiotic relationship.
No, that's great. Caitin, first of all, I love Claudia's line of progress moves at the pace of trust. I think that's fantastic. You were developing, really the first or one of the very first family support models that was based on evidence. How did you build that trust initially with the families, with the communities to be able to do that work?
Well, first of all, we didn't try to queer them, and that had a big impact. We started where they were. I mean, I'm a clinical social worker. There are any social work students out there, that's the first thing you learn in social work school. So that meant, first of all, understanding a lot about culture and belief systems before we started doing the work, so that we'd do a cultural assessment with families on their cultural beliefs and values, their religious beliefs and values. To us, religion is a culture too. So from day one, we've worked with, very conservative religious traditions. In fact, I worked behind the scenes with the Mormon Church for 10 years, and many, many bishops all over the U.S. and other countries actually use the best practice booklet that we developed for suicide prevention for Mormon families. We've now developed one for Catholic families. We've really disseminated hundreds of thousands of copies, but it means starting where their systems really live, and that meant engaging them, as I talked earlier, about having everybody sit around the table with us from the very beginning and make sure that we were all on the same page, that we were approaching their lives from how they lived them and what was important to them. We also, every step of the way, we've always taken the work back. So it wasn't just upfront and engaging families. It wasn't just working with them. It was actually helping them teach us what our findings meant. And we spent 2 whole years with really, really diverse families and young people, having them teach us how to talk about our findings with families from very different kinds of backgrounds, what kinds of materials were needed, what should they look like. We worked, for example, with Q Corner for years to get our work out here in Santa Clara County and other places, but continually coming back, continually learning from the source. We're not the experts in their lives, they are. And because they trusted us, because we gave them accurate information, and I think the fact that our work is behaviorally based, we could start with their behaviors, we could show, because we identified and measured over 100 different behaviors that impact risk and well-being, we could show them that their behaviors matter. We weren't there to change their beliefs. In fact, we respected their beliefs, but their behaviors had a huge impact. And because they trusted us, because of the way we entered their cultural world, they took what we said, as truth, and then they began to see that things were changing profoundly with their children. And we also worked with their cultural worlds, with their cultural and religious leaders, with their organizations and their systems, building the kinds of, interactional trust that has been talked about on the panel. We're not the experts. They're the experts, and I think they understood that we knew that. And I think that sense of respect, and that word cultural humility, it's kind of cute, but it's true. I mean, when you approach their lives with a need to understand and a need to want to support, and also a level of expertise, because I've worked in this field now 50 years, and I have seen an enormous amount about what works and what doesn't work, and families would ask me about that. So I could share from my own experience as a clinician, but also across the course of my life, because I've seen extraordinary changes in our community. And even though we're going through a really dark period now, we're going to come out of it. We're going to come together as a community, really as a community of families, to stick in, to be resilient, to let our strength and capacity shine through, and we will help each other. There will come a time when this is in the past. It's just really hard right now.
No, I appreciate you highlighting sort of that long arc and different periods of time. This is nonetheless a very challenging time that we are in, and a very complex time that we're in. And Claudia, I wonder if you can talk about, how in an ideal world, how could philanthropy, the tech industry, LGBTQ plus community leaders, academic researchers, best come together to sort of sustainably implement digital and mental health solutions for LGBTQ youth?
Yeah, it starts with community and with young people, young LGBTQ plus young people at the center of it. And oftentimes I think we are talking about programs or interventions that are focusing on LGBTQ plus young people. And I think importantly, we need to recognize that LGBTQ plus young people are part of larger communities. And so when we think about how we can come together, we could come together to provide resources and tools for their families, resources and tools for their peers inside schools, resources and tools for the community, right? Third spaces, everyone's talking about the importance of really of building and creating and having, and gratefully Centerlink is, offering that, but really leaning in. And so when we come together, I think we need to move beyond putting the work on shifting behaviors in LGBTQ or developing skills, and really think more about how are we going to create communities of kindness, communities of support, communities of belonging for LGBTQ plus youth.
John, anything you want to add on that?
Yeah. Following directly on that, we asked about 10,000 LGBT youth across the country how they would prefer to receive mental health services. And the majority said that they would, when given the choice or an opportunity, they would rather receive mental health services from a trained professional in their local community. If I asked you all that, you would say you would probably prefer to receive mental health services from a therapist, a trained therapist in your local community. That doesn't mean that digital tools don't have a role. The U.S. also has over 1 million mental health providers. This isn't an unpopular profession. So following Claudia's suggestion of how can we respond to LGBT stated requests for another person on the other side to see them and to validate them, take advantage of this huge community of mental health providers who can offer that type of validation and accurately seeing these LGBT youth for who they are, without totally kind of punting this to something that most of us would probably not sign up for, which is to treat our major depression, our PTSD, our addiction through an app. We would probably want someone, and ideally a community, and maybe a community, some of whom are trying to treat those things on the other side of this.
Great. Let me open it up a little bit now so we have a chance for you all to ask questions. So we have an amazing group here.
Thank you. Hi, so my name is Annie Nguyen. I'm a school-based mental health therapist, and I work with elementary and middle schoolers. And something that's come up over the summer was the Mahmoud versus Taylor case, of which parents have the right to opt out of information that has any, regards to LGBTQ plus topics. And so as a mental health therapist working with these students who are LGBTQ plus youth, I'm curious about, from your perspective and expertise, how can we help support not just the system with the teachers and the other school staff, but also with the parents and families? Because we can see the impact, and we can see how the youth and others are responding to it. So I'm just curious, as the clinician's expertise, how you would respond.
Sure. Most parents, I would say, the majority of parents want to support their child. And I think inviting them into the conversation and having, and providing them with resources and tools, because what I have learned in talking to some families and parents is that some don't know how to have these conversations. And the lack of engaging is sometimes just a lack of knowledge and understanding, and giving them the tools to engage in. And that's why we created the resource guide for families, for that reason, so that they have the language. And something I love to also highlight of this resource guide, we brought it to our advisory board. And when we brought it to our advisory board, we said, provide feedback on this resource guide for parents and families. And they said, we need a section for what if I make a mistake. It was so humbling to hear that, right? This generation is like, it's okay to make a mistake, it's okay to stumble, but let's talk about how to repair that then, and how to move forward in this mistake. And so we added a section on our resource guide that focused on what if I make a mistake and how to repair the relationship after that. And so I think providing parents and families with these tools, that would be my first step, so that they have the language as well.
If I could add to that, not only those kinds of materials, but also training for all school personnel on family support, on the role of families, on how critically important they are. As you know, schools and primary care are the two places where you can really do upstream early intervention. You can identify children and young adolescents who really need help that will make a profound difference. But one of the big challenges is schools are innately conservative, and that means that they don't want to teach about sexual orientation and gender identity. And that's true in our Bay Area communities, it's true in the New York area, it's true across the US, it's not just in the red states. And helping our district leadership understand that these are health and developmental needs. And we do have regulatory directives about making sure that parents and caregivers understand their children's health and developmental needs, and that schools are dealing with this in the appropriate way. This, in my mind, is a huge gap. It's a leadership gap. People are reluctant, now they're afraid, now they're pulling back. This is something that, county leadership can pull together. Your agencies, your supervisors, others, to make sure that schools really understand the profound need. For your average parent or caregiver, schools are a trusted source. They're going to be so much more trusted than a community agency. That's where we teach about the autism spectrum and children with a whole range of different kinds of needs. But there are health and developmental needs for LGBTQ young people, and you don't hear a word about them. And families are typically engaged. Education is provided, referrals are made. That's not really happening in this case. And I would start with training. And I would start, there are sources like the Q Center that has a lot of resources to point you in the direction of what does appropriate training look like and what kind of a difference it can make.
Hi there. So I had a question that popped up in the previous panel, but I think you all are well equipped to answer the same question, which is, if we take sort of the situation that we're in a larger context of healthcare in America, restrictions in certain states against reproductive health care, and then in certain states preventing trans youth from getting the medical services that they need. My question is from your perspective, how do we prevent sort of, from a political standpoint, efforts to prevent Medicaid reimbursement for certain services, or efforts even to micromanage what services you can, in fact, access, such as transgender mental health care in the larger context, it does seem like, apart from going to the politicians to talk about what sort of services not to micromanage, or other authoritative services, how to keep the dollars flowing in this space?
I think there's two issues: keeping the dollars flowing and awakening public and elected officials to these profound needs. And there's nothing more powerful than parents, families, caregivers advocating in the public sphere about the needs of their children. And this takes organizing, but it has a powerful impact. It's had a powerful impact on so many health and mental health conditions over the years. And you're in a really progressive community. This is a very progressive Catholic school, for example. You have so many resources that can mobilize very diverse communities, because this is also a really racially and culturally diverse community, and you have to organize in all of those groups. We were recently approached by a whole statewide union of caregivers to train them, to create a whole system for training them on how to provide support for LGBTQ people, especially, children, the kinds of services that our caregivers routinely offer. And that's another source that most people never even think of. Think of all those unions. They're all over the United States. And so many of them have LGBTQ members, family members, children. They're really concerned. There are so many people that are concerned, but they don't know what to do. And this is something that you have the resources here to do this. Not every county has the resources that you have. And I know you're from all over the U.S. and other places, but start with a small group and it can grow. I think people they're looking for leadership. They're looking for what to do, and they don't know what to do because we've never been in the situation that we're in now. But that's not going to stop us. We will move forward.
I also wanted to thank you for asking that question. I think that's something that we all are grappling with. Right? It's a real question. I think it's looking at there's a lot to be frustrated with, and so looking at the situation and really thinking about how can you speak up and speak out safely, and what is that in what capacity, and so always taking into consideration, is it your local community, is it, there's different ways to do it. Something that has been incredibly therapeutic for me. I've been writing lots of op-eds. So I take my rage and I put it in an op-ed, and I think I think we as scientists, there's a lot of good research that's happening, and so at Born This Way Foundation, we've actually been partnering with scientists to share their research more broadly to on our social media, and share the science and share the work of the experts that are really doing incredible work that needs to be shared. We also have a platform called Channel Kindness. And that's a platform for young people to write their stories and share their work and their thoughts and opinions on these topics. Because my hope, and again, this is my hope because I have to have it in this moment, is that someone will read it who's making a decision, and it will influence them.
I think it's a huge question you've asked. It doesn't have one answer. So, preface my comments with that. But I do think that there's an unclear narrative, particularly when we're talking about trans youth, because the average citizen wants health, wellness, happiness, success for all children. And it's important for us to remember that someone who is against gender-affirming care for a young person is not doing that out of hatred. Sometimes they are, but there's a very strong narrative in this country right now that there's that social media is influencing youth to be this way, and those pieces. And so I don't know exactly the mechanisms, but I do think that part of it is that changing that narrative, that we have to really be open to conversations and create situations, whether it's op-eds or trainings you're doing, or communications at the school board level or whatever it is, where we really talk about the harm that is done to young people when they don't get the care that they need, and understanding and listening. Like, yeah, social media influences young people, but let's look at the data, let's look at the stories. You know, there are more stories out there that are and those stories get picked up on social media. How can we counter that when those stories are not telling the full picture? And I think it is that narrative that I feel like is the biggest issue right now for trans youth, because I know people who care deeply, but think that young people are being persuaded to do this, rather than that it's a truth for them. We have to be able to counter that narrative, which I believe is probably true in a very small number of cases, and therefore we're hurting many youth when it's not true.
I appreciate that. And I appreciate you pointing to the sort of the op-eds you're writing as a way to channel. And I think sometimes people feel like, well, unless I'm in X position and I can get it in the New York Times or something, then it's not. And I think encouraging lots of people to pick up the pen, recognize that really everybody in this room has important voice to share in this discussion.
And please, if you are, I believe it's between the ages of 15 and 24, 15 and 26, please look at our Child Kindness platform. We welcome you to submit something to post there. We want to hear from you, and we want you to share your stories. And, and our research team is always geeking out about how to help and support you, so please let us know.
Great.
Sorry. I really appreciated all the sentiments that you guys shared about centering families and communities within this area of research. I work on a project at Boston Children's called the Trans Teen and Family Narrative Project, and one of our forward goals for the project is to incorporate more multiply marginalized families of trans teens. So trans teens who have been in foster care, trans teens of color, so on and so forth. And I think one question I had was, especially some of the sentiments about not tokenizing youth or families, when you're beginning research or extending a research project with the goal of diversifying the narratives of the research project, how can you best approach compensating and really centering the voices of the family, giving them both monetary, whether it's financial compensation or other forms of compensation, in a way that centers that specific community's needs? I don't know if that question makes sense. Particularly when you're diversifying the participants in the study or working within a family structure rather than just a single participant.
I'm not sure I have a direct answer, but I think it goes back to ask people. A genuine conversation. For example, when we give out composition to youth, sometimes there's the organizational structures, you can't pay them, W-9s, blah, 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 blah. So it's gift cards. Okay, well, everyone's like, oh, well, Amazon's so easy to get a gift card. Some kids don't want an Amazon gift card. So even asking, what kind of gift card do you want? So going to the people who you're hoping to reach, finding the communities, if you don't already have those people in your circle, then finding other organizations that would be, would be supportive of your work, and asking them, whether it's a Black church or, a cultural organization, to see if they would be able to talk with you initially and build that trust with those individuals at the organizational level, to then connect you with the individuals who might be the folks you'd involve. That's my recommendation.
I appreciate your point you're raising, because I think, Deborah, you're pointing out that sometimes I think we engage with, we have youth advisory boards as well in the work that we're doing. I think sometimes there's a tendency to think that the youth advisory board is really just communicating on the content of the intervention being developed, or the content, and I think recognizing that they play an essential role, and also thinking about the process as well, right? What gift cards? How do you want to be prompted when you're asked questions? How do you, really engaging in all parts of whether it's a research study and a program that's being implemented, really at every single piece of it.
Yeah. And just as a small example, and this comes to me all the time, which is why I'm going to share it with you. So when we first launched Q Chat Space, I went like very little resources. I basically like put out the word to my local GSAs and got a bunch of kids to meet at the library and look at my mock-ups. And I learned that kids don't know what time zone they're in. And I needed to get a developer to do a back-end thing to like show it in their time zone. Like I realized that nobody would show up if they didn't know what time it was. It was a small thing, but like knowing your audience, knowing those little things. I'd been working remotely for years. I knew time zones and all the time in my head. So little things can be quite important, and you don't know if you don't talk to the person who's coming from that perspective. Multiple people, not just one.
Well, we could carry on this conversation for a long time, but we just have a couple minutes left, so I'm going to give each of you a chance to sort of share any take-home thought you'd like to share, and maybe a piece of advice in thinking about, what do you wish you had known 10, 15, 20 years ago when you were doing this work to pass along to others?
I guess I wish I'd known that I could have started it sooner. But we do have a table where we brought a lot of materials. We encourage you to take them so I don't have to take them home with me. We have all kinds of different resources. In fact, our family education posters are in 11 language and cultural versions, and we've found a 75% behavioral change when people use the posters, and we've disseminated hundreds of thousands of copies of our multilingual family education booklets. We've found that people can change in their own space. It doesn't have to be in some kind of an intervention. There's a lot of families that are just looking for guidance and a place to start. And we've heard from so many diverse people who've used our materials, including older trans adults who've taken our family education materials back to their families when they wanted to reconcile, and who said now they finally can understand what happened to me when I was younger. So take our materials, and thank you for this opportunity.
It's all about the relationships, and this work is really hard. And so taking time, taking care of yourself, taking care of your community. My partner does vaccine research. I'm currently in the middle of LGBTQ plus research, so it makes for interesting dinner topics and conversations. And we committed to going for runs after dinner, a couple hours after we've eaten, because we need to find a release. So finding ways to come back to the drawing board the next morning, but take good care of yourself at night.
I would say my one piece of advice is that I think the overarching culture here in the United States is that people will succeed and do these amazing things and your resume and blah, blah, blah. But then in reality, that's not what happens. Like no one does anything alone. We're completely interdependent. And I think really digging into that and knowing that you have to reach out to partners. You have to work in collaboration. No one will succeed at anything on their own entirely. And not knowing that and then using that is probably the biggest piece of advice I'd give.
Mine too. And there's a lot of disincentives in our society to following that. Federal funding or NIH funding means that the researcher has to be in control. Probably the demands of the tech industry mean that the app developer has to have some control. But those don't create equal partnerships, and they probably don't create the most productive partnerships. The most productive partnerships are going to be those that provide a space for people in academia to show up with theory and evaluation expertise, people in the tech industry to show up with technical expertise, but ultimately the ideas have to come from the community. But unfortunately, the funding structures for this work often put a lot of constraints and a lot of pressures against that ideal.
All right, well, we are at 12, but please join me in thanking this fantastic